Ever wondered about the terms SIRS, sepsis, severe sepsis, and septic shock? These are medical conditions that can occur when your body responds to an infection. But what do they mean, and how are they related? Listen closely, and by the end of this discussion, you'll have a clearer understanding. First up, we have SIRS, which stands for Systemic Inflammatory Response Syndrome. Picture this. Your body is a well-tuned machine, and when an infection or injury occurs, it launches a defense, like an army ready for battle. This reaction involves increased heart rate, rapid breathing, high or low body temperature, and abnormal white blood cell count. When your body exhibits two or more of these reactions, it's said to be experiencing SIRS. Next, we move to sepsis. Think of sepsis as the next level of SIRS. It's what happens when the infection causing SIRS gets into the bloodstream. The body's defense system goes into overdrive, causing widespread inflammation that can affect organs like the heart, lungs, and kidneys. Sepsis is a serious condition that needs immediate medical attention. Now let's turn our attention to severe sepsis. This is an escalated stage of sepsis where the body's overreaction to an infection begins to cause organ failure. It's as if the body's defense system is so overwhelmed that it starts to shut down its own operations. Symptoms can include decreased urine output, abrupt change in mental status, decreased platelet count, difficulty breathing, abnormal heart function, and even patches of discolored skin. Finally, we reach septic shock. This is the most severe stage, where the body's response to infection leads to dangerously low blood pressure that doesn't improve with simple fluid replacement. It's like the body's defense system has been so overrun that it's on the verge of collapsing. Septic shock can cause multiple organ failure, and in the worst-case scenario can be fatal. To recap, SIRS, sepsis, severe sepsis, and septic shock are stages of the body's response to infection. They start with a systemic inflammatory response, SIRS, which can escalate to sepsis when the infection gets into the bloodstream. If the body's response becomes more severe, causing organ failure, it's severe sepsis. And the most critical stage, septic shock, occurs when the infection leads to life-threatening low blood pressure. Remember, these conditions are serious and require immediate medical attention. Recognizing the signs and understanding the progression can help ensure timely treatment. It's always better to prevent than to cure, so maintaining good hygiene practices and getting timely vaccinations can help keep infections at bay. That's a wrap on SIRS, sepsis, severe sepsis, and septic shock. By understanding these terms, you're better equipped to recognize and respond to these conditions. Stay informed, stay healthy.